What is Zika virus? Zika virus is a mosquito-borne virus first identified in Uganda in 1947 in a rhesus macaque monkey, followed by evidence of infection and disease in humans in other African countries in the 1950s. From the 1960s to 1980s, sporadic human infections were detected across Africa and Asia. However, since 2007, outbreaks of Zika virus disease have been recorded in Africa, the Americas, Asia, and the Pacific. In outbreaks over the last decade, Zika virus infection was found to be associated with increased incidence of Guillain-Barré syndrome. When Zika virus emerged in the Americas, with a large epidemic in Brazil in 2015, an association between Zika virus infection and microcephaly smaller than normal head size was first described. There were similar findings in French Polynesia upon retrospective review. From February to November 2016, who declared a public health emergency of international concern (FIIC) regarding microcephaly, other neurological disorders, and Zika virus, and the causal link between Zika virus and congenital malformations was soon confirmed. Outbreaks of Zika virus disease were identified throughout most of the Americas and in other regions with established Aedes aegypti mosquitoes. Infections were detected in travelers from active transmission areas, and sexual transmission was confirmed as an alternate route of Zika virus infection. Cases of Zika virus disease globally declined from 2017 onwards. However, Zika virus transmission persists at low levels in several countries in the Americas and in other endemic regions. In addition, the first local mosquito-transmitted Zika virus disease cases were reported in Europe in 2019, and Zika virus outbreak activity was detected in India in 2021. To date, a total of 89 countries and territories have reported evidence of mosquito-transmitted Zika virus infection. However, surveillance remains limited globally. What are the symptoms of Zika virus? Most people infected with Zika virus do not develop symptoms. Among those who do, they typically start 3 to 14 days after infection, are generally mild, including rash, fever, conjunctivitis, muscle and joint pain, malaise, and headache, and usually last for 2 to 7 days. These symptoms are common to other arboviral and non-arboviral diseases. Thus, the diagnosis of Zika virus infection requires laboratory confirmation. Where is Zika virus found? The mosquitoes that carry Zika are found in many parts of the world. There have been outbreaks of Zika in the Americas, the Caribbean, and parts of Africa and Asia. Is there a current Zika virus outbreak? There was a Zika epidemic from 2014 to 2017 in the Americas, with outbreaks in the U.S. in 2015 and 2016. Cases of Zika in the U.S. since then have been in people who got infected while traveling outside of the U.S. How serious is Zika virus? Zika is very serious for people who are pregnant because it can interfere with the fetus's development. Zika is usually mild for most other adults and children. What causes Zika? A type of flavirus, an RNA virus usually spread by mosquitoes, causes Zika infections. The viruses that cause dengue fever and West Nile infections are also types of flavivirus. How does Zika virus spread? Zika virus can spread in various ways. The most common method of transmission is through the bite of Aedes aegypti and Aedes albopictus mosquitoes, which are found in many parts of the world, including the U.S. These mosquitoes spread Zika by biting an infected person and then biting someone else. Additionally, if a pregnant person contracts Zika, the virus can pass through the placenta to the fetus, potentially causing congenital conditions such as microcephaly. Zika can also be transmitted through sexual contact, as the virus can remain in body fluids like semen for weeks to months after an infection, even if symptoms are absent or have resolved. Furthermore, although there have been reports of Zika transmission through blood transfusions in Brazil and France, there has never been a reported case of this occurring in the U.S. What are the complications of Zika virus? Zika virus infection during pregnancy is a cause of microcephaly and other congenital malformations in the infant, including limb contractures, high muscle tone, eye abnormalities, and hearing loss. These clinical features are collectively referred to as congenital Zika syndrome. The risk of congenital malformations following infection in pregnancy remains unknown. An estimated 5 to 15% of infants born to women infected with Zika virus during pregnancy have evidence of Zika-related complications. Congenital malformations occur following both symptomatic and asymptomatic infection. Zika infection in pregnancy can also cause complications such as fetal loss, stillbirth, and preterm birth. Zika virus infection can also cause Guillain-Barré syndrome, neuropathy, and myelitis, particularly in adults and older children. Research is ongoing to investigate the risk and effects of Zika virus infection on pregnancy outcomes, strategies for prevention and control, and effects of infection on other neurological disorders in children and adults. Transmission. Zika virus is primarily transmitted by infected mosquitoes of the Aedes genus, mainly Aedes aegypti, in tropical and subtropical regions. Aedes mosquitoes usually bite during the day. These mosquitoes also transmit dengue, chikungunya, and urban yellow fever. Zika virus is also transmitted from mother to fetus during pregnancy, as well as through sexual contact, transfusion of blood and blood products, and possibly through organ transplantation. Diagnosis. Now, infection with Zika virus may be suspected based on symptoms of persons living in or visiting areas with Zika virus transmission and/or Aedes mosquito vectors. A diagnosis of Zika virus infection can only be confirmed by laboratory tests of blood or other body fluids, and it must be differentiated from cross-reactive related flaviviruses, such as dengue virus, to which the patient may have been exposed or previously vaccinated. Treatment. There is no specific treatment available for Zika virus infection or disease. People with symptoms such as rash, fever, or joint pain should get plenty of rest, drink fluids, and treat symptoms with antipyretics and analgesics. No steroidal anti-inflammatory drugs should be avoided until dengue virus infections are ruled out because of bleeding risk. If symptoms worsen, patients should seek medical care and advice. Pregnant women living in areas with Zika transmission or who develop symptoms of Zika virus infection should seek medical attention for laboratory testing, information, counseling, and other clinical care.